My name is Dorle Verrinder. I'm a dietitian and a lactation consultant. And today we're just going to talk a little bit about common myths and misconceptions about breastfeeding. And I'm going to just answer some very simple questions about breastfeeding, how breastfeeding works, and some general tips about how to carry on breastfeeding. So one of the most common challenges that new mums have is that breastfeeding hurts. And another common challenge, especially in the early days in hospital, is that baby may not latch to the breast immediately. It may take a day or two. And if that happens, what a mum can do, whether baby is away from mum, for example, in the neonatal ICU, or simply can't hold onto the breast very well, is to express a bit of colostrum. So a mum can simply use her hands, use a spoon, and very gently squeeze out the colostrum. And then the colostrum can be either fed to a baby directly from the spoon or drawn up in a syringe and stored for later, and maybe brought to the neonatal ICU for baby if baby can't breastfeed directly. If the latch is painful, that's usually because the baby is not grabbing the breast well enough. So if a baby is just here on the front, on the nipple, it hurts mommy and baby doesn't really get a lot of milk out. So we're looking at positioning where baby can just have a deeper latch. And usually we use a position where baby needs to be tummy to mommy and mommy leaning back. And often that solves any pain with breastfeeding. One other thing that might happen is that mums have overly full breasts once the milk starts changing. And if that happens, you can again use your hands to express your milk and soften the breast before a feed. And often that's all that needed so that baby can latch on better. So breastfeeding has benefits both for the baby and the mother. So breastfeeding is normal. We're mammals, we breastfeed. And when a baby is born, the immune system is quite immature. So baby is quite reliant on having that first milk, we call it colostrum, from the mother, because that gives baby a lot of protection against infection. And during the course of the whole breastfeeding duration, so the World Health Organization recommends to exclusively breastfeed for 6 months, but then to carry on breastfeeding for 2 years or longer if possible. And throughout that duration, mother's milk changes. It changes every day to be just perfect for what baby needs at that particular stage in its life. And protection from breastfeeding also it relates to infection. So we know that formula-fed babies have higher rates of hospital admission, diarrhea and vomiting, ear infection in the first year of life compared to breastfed babies. And we also know that formula-fed babies are more likely to be overweight at 1 year. Breastfeeding is also like a milestone. It helps with oral development for the baby, and it helps with social and psychological development as well, because breastfeeding is a responsive parenting situation where the mother responds to the needs of her baby, which is very, very beneficial for baby's social skills. We also have benefits for the mother. So we know that mothers are protected, or they have a lower risk of developing breast cancer, ovarian cancer, and endometrial cancer if they breastfeed, and especially if they've breastfeed several children, and also if they breastfeed for longer. A very obvious advantage of breastfeeding is that it's cheap, or it costs nothing, in fact. Whereas if you formula feed your baby, you have to buy the formula milk, you have to buy bottles, you have to sterilize them, and you need to clean them. And you also have the disadvantage. Breastfeeding is convenient. Mum can only just needs to take baby and put baby to the breast. Mum doesn't have to boil water first, mix formula, wait for it to cool down. It's much more convenient. We also know that mums, if they breastfeed, they are more likely to lose the weight that they gain during pregnancy. In fact, the body lays down the stores during pregnancy so that the body has extra storage to draw from to make breast milk, because that takes calories. And also breastfeeding actually helps with birth spacing. So if a mum that exclusively breastfeeds is likely to have her period back a lot later than a mum who formula feeds. And that helps with the mum to recover after birth before she falls pregnant again. So it's like a natural contraceptive, if you like. And finally, breastfeeding is good for society. Making formula milk actually has a high carbon footprint, more CO2 emissions, and actually society benefits if more mothers were breastfeeding for longer. And we know, for example, from the World Health Organization that if we increase breastfeeding rates to levels where almost everybody would be breastfeeding, we could save over 800,000 lives a year worldwide. So one of the most common myths that I encounter with my patients is the belief that the breasts need time to fill up after baby has fed. And that can lead to mums delaying feeds or spacing feeds or scheduling feeds because they feel the breast hasn't filled up yet, and it actually reduces milk supply. What actually happens with the way the body makes milk is that the more you feed your baby, the more the body makes milk. So it's kind of like use it or lose it, like a supply and demand situation. So the more often you feed your baby and the more often the baby removes the milk, the more the body can replace it. And that's one of the common myths, that mums wait and they don't feed baby often enough, and actually that reduces supply. So whenever the baby feeds, even while the baby is feeding, the breast is already replacing milk and filling up again. Another common myth is that mums need to eat certain foods, or they need to drink more fluid, or they need to, drink certain potions or mixtures or tablets or lactation cookies to make more milk. When in actual fact, we are quite evolved as mammals to breastfeed, even in situations of hardship or when we don't maybe have that much food available, and that's why we've survived as mammals. So mum doesn't have to have a perfect diet, and mum doesn't need to eat certain foods to make more milk. Quite the opposite. Mum should eat to hunger and mum should drink to thirst, but she doesn't have to force herself to eat more or drink more than she actually feels like. And what makes milk is just putting the baby on the breast more often. Another misconception that I encounter quite a lot is that when the baby cries, that mums interpret it as baby having pain or cramps or winds, or the nappy is wet, when in actual fact, most of the time when the baby cries, baby says, "Please feed me, mommy, I'm still hungry." And babies tend to feed much more frequently than you mums think. So whenever your baby is crying, always think, will baby drink? And if you put baby to the breast and baby still opens the mouth and still goes on, the baby is still hungry. So you will know that your baby is doing well at the breast if the baby suckles well. So baby should attach well to the breast, stay on the breast and suckle vigorously, and you should hear the swallowing. Every few sucks or so you should hear a swallow, and you can hear it because it sounds a little bit like a little k. So once the milk has come in after day 3 or so, you should hear the swallowing quite frequently. Also at the beginning of a feed, babies are usually quite alert, eyes are open, little fists are closed, and babies suckle quite vigorously. And then as the feed progresses, you will see little eyes closing, little fists opening, and baby relaxing. And when the baby is finished, baby will let go of the breast and be either really relaxed and not want to go on the other side, or still want to feed on the other side. And if the baby still opens the mouth and wants to feed more, you offer the other side. And you can keep switching sides until baby is completely satisfied. Another way to know that baby is getting enough milk is that you will, once the milk has started coming in around day 3 of life, that baby will start passing more wet nappies and more stool nappies. And latest from around day 5, baby should have nice and yellow stools, at least 2 to 3 a day, and pass lots of wet nappies. So good 5, 6, 7, 8 heavy wet nappies a day. In hospital, baby will be weighed every day until you leave hospital with baby. And it's very normal that babies lose weight in the beginning. But once your milk starts changing, which is around day 3 or day 4, baby should start gaining weight again. So it's a good idea to take your baby on day 5, so usually day 4 or day 5, 2 days after you leave hospital, and get baby weighed. And if your milk has already come in, we should see a weight gain. And if we don't see a weight gain, then we know we need to look at the breastfeeding a little bit more closely just to see what's going on. And finally, a baby that thrives and that does well at the breast is also a baby that is quite satisfied after feeds, will not do a lot of crying. So if your baby cries, always offer the breast again so always think baby might be hungry before you look at other causes for baby crying. So pain with breastfeeding is quite a common issue in the beginning, and pain is actually not normal. So pain always, like with all other reasons when the body shows us pain, is that something is not quite right. And certainly with breastfeeding, if it hurts, it's usually a sign that baby has not latched deeply. Baby has simply holding onto the nipple at the front rather than taking the whole nipple deep in the baby's mouth. So with pain with breastfeeding, I mean, that's the most common. There are a few other reasons why breastfeeding might be painful, but in terms of latching, that's the most common reason. And what we can do to make baby latch better is sometimes just change the position. So most moms instinctively have like this kind of cradle hold where they cradle the baby, but are often told to sit upright. And you can imagine if you sit upright, you get tired over time and baby falls away from you. Whereas if you lean backwards and you take baby with you on his tummy or on her tummy, you can see how baby is pushed against mommy and will have a much deeper latch. And that can be in this position or it can be in this position. It doesn't matter too much, but we want mommy to lean back comfortably and to baby to be on his or her tummy, being pushed against mommy. And often that in itself means that the latch is much deeper. There are a few other things we can do to make a good latch. For example, we can shape the breast a little bit like a burger. So we can take the breast and we can kind of make it long and thin so that it fits in, so baby can have a bigger mouthful. That's another option. But generally it's about the positioning. If mommy already has cracked nipples, that's quite sore, and some mums may choose not to breastfeed for a day or so. That can be an option if we really can't make the latch less painful. And then you would really want to use moist wound healing on the nipple. So you would either express a little bit of breast milk and leave it there. And you can make yourself a little nappy donut if you like. So roll up a nappy so that it sits over the nipple like this, but that nothing touches the wound. And that allows the cells to move nicely and repair well. And once the nipple is healed, then baby can latch and it'll be much less painful. If we can make the latch more comfortable, then I would always encourage mom to continue breastfeeding. But if she doesn't want to breastfeed because it's so very, very sore, then she can, just as before, she can express her milk onto a spoon in the early days, or she can take a little cup and just express her milk into a cup and then feed the milk to baby in the cup. So we would feed baby with the cup like so, just that baby gets the milk and that the milk keeps flowing. And we try to avoid bottle feeding. The World Health Organization does not recommend bottle feeding for the first 2 to 6 weeks of life or until breastfeeding is established. So breastfeeding in the early days, like the first 2 weeks, can be really, really hard. And it's new on every level. So you have a new baby and you are quite sleep deprived probably, and maybe breastfeeding is hurting a little bit. So it can be quite hard in the beginning. But if a mum is completely overwhelmed, I would like to look at her support system. So really get the partner involved, see who else is living in the household who can help. And as you know, it takes a village to raise a child. So everybody else who is family, friends should try and help. And we certainly don't want mum to do any chores or cleaning or cooking. Mummy should really rest, stay with baby, cuddle with baby, hold baby in skin-to-skin contact, and try and recover from the birth and spend a lot of time with baby, trying to connect and bond with baby. And the best way to do that is to have baby in skin-to-skin contact. And skin-to-skin contact is really, really important for bonding, but it also is important for breastfeeding. So skin-to-skin contact would be a naked baby just wearing the nappy, and a naked mum not wearing a bra, not wearing any clothes, holding baby on her chest. And then we would put a big blanket over both of them to keep them warm. And skin-to-skin contact is really, really important for bonding. It's important for milk supply, and it helps a baby also to regulate his or her breathing and heart rate. Baby gets good bacteria from mommy's skin, and it brings out baby's neonatal reflexes that he or she is born with to breastfeed. So any breastfeeding problems that arise, the first advice I always give is to hold baby in skin to skin as many hours a day as possible, at least for the first 3 months of life. That includes the dad, by the way. So dads are very much encouraged also to do skin to skin contact because it makes them more confident handling baby, and it will also help them bond with the baby. What can also, when mum is very overwhelmed with breastfeeding, I would also like to look at her sleeping arrangements. Baby should sleep in the room with mum. Actually, mummies get more sleep if the baby is close to them than when the baby sleeps in a different room. And it's certainly advisable for the first year of life to have baby sleep in the room with the parents. Another thing I would probably want to look at with mum being overwhelmed with breastfeeding is just to make sure the breastfeeding is comfortable. Often pain can contribute to the feeling of feeling overwhelmed. So that's the first thing I would want to look at, just to make sure that the latch is comfortable. And also checking if baby's feeding effectively. What can often contribute to mum feeling overwhelmed is a baby that cries a lot. And if a baby cries a lot, baby's trying to tell us something. And in many cases, it's because baby maybe is not feeding effectively. So I would really want to see that the breastfeeding is working well, and that can help mum to cope with the demands of being a new mum more easily. In Namibia, unfortunately, we have to go back to work quite soon, so 2.5 months or 3 months after giving birth, which makes it challenging to continue breastfeeding, but it is possible. So what a mum can do before she goes back to work is to start pumping her milk and freeze it. So breast milk can be frozen for 6 months, and build up a stash in the freezer so that when you go back to work, you have kind of like insurance in the freezer. And then when you're at work, you would need to continue pumping when you're away from baby, to have milk to feed the baby the next day, and also to keep your milk flowing. So if you were to switch to formula milk for the time that you're away, your body would stop making that amount of milk that you give as formula because there's no stimulation for those hours that you're at work. So what you can do when you go to work is you can take a little cool bag like this, where you take an ice pack in the morning from the freezer, put it in your bag, and then you'll have your storage containers. So it can be glass jars like this, just old glass jars. Ask your friends and family to collect these for you. This is a very good way to store breast milk. And that can be anything like this. That means you don't have to buy products. You can also use bags, storage bags. They are specifically for storing breast milk, something like this. They're Ziploc bags, but they're single use, so you'll have to throw them away, whereas glass jars or also bottles you can keep reusing. And then you would pump at work. You'd pump every 2 to 3 hours, or however often baby would feed when you're at work, and then you would store the milk in here, take the bag home with you, and put it in the fridge, and that's the milk the baby feeds the next day. What is quite important is that you talk to your manager, and that you just let them know you're a breastfeeding mom, you want to come back to work, and can they please make available for you a room that is private, and that is clean, where you can do your pumping, and that they also make allowance for break times. And we know, for example, from studies that it's in the best interest of an employer to allow that, because we have better staff retention, for example, in companies where the employees are allowed to pump milk, and we have better staff morale. And if you think about it, if you continue breastfeeding, your baby will be less likely to be ill, and therefore mums will not have to take so much time off work looking after their ill baby if they continue breastfeeding. So it's really in the interest of the employer to make this available for the mum. So I suggest before you go back to work, just make sure you plan, have some storage milk, and talk to your manager. So nutrition is important for the well-being of the mother. It is not all that important in making enough milk, as we've discussed before. So if a baby feeds frequently, mummy will make milk. But nutrition, good nutrition, is good for the mum in terms of her recovery. So generally, just like healthy eating guidelines for everyone else in the population, mum should eat lots of fruit and vegetables, lean protein, and really avoid processed or refined foods, fried foods, takeaway foods. All of those foods are not very nutritious. They give us too many calories, and they can make us feel not very well. But in terms of breastfeeding, mums can eat anything. So there's a lot of myths around foods that are to be avoided while breastfeeding, and really mums can eat everything with just a few exceptions. One thing is caffeine. So mum is allowed to take some caffeine. Typically 2 to 3 cups of coffee a day or black tea are perfectly fine. If you have 10 cups of coffee a day, that might be a little bit much, because caffeine does pass into breast milk and it might make your baby quite irritable or sleepless. So with regards to alcohol, alcohol does pass into breast milk, and of course it's not very healthy for baby to take any alcohol. It's not safe. But if you have one small drink and you wait at least 2 hours after drinking, the liver will have metabolized the alcohol, and after at least 2 hours or a little bit longer, you can breastfeed or pump the milk. And that is okay if you do that occasionally. So we know that breastfeeding is normal, and we know that breastfeeding can be quite challenging. I hope this video has helped you to understand how breastfeeding works and how to overcome some common problems that mums have. And I hope it helps you to reach your breastfeeding goals. And that's it from me today. Goodbye.